Okay, so this is about where we had left off with in your last class period. And when it comes to the respiratory system, again, there's two portions that make up that anatomy. You have a pharynx and a larynx. And in the upper respiratory tract, known as the throat, is going to be your pharynx, and that's going to form the opening to that of the esophagus. And what happens is as you swallow liquids or food particles, your epiglottis is a structure that will flip down, and then that covers your esophagus. The glottis then is just a little further down, and that actually covers the vocal cords. And one way to keep them separate is we know that when it comes to the portions of the skin, you have a living layer called the dermis, and then the outer or uppermost layer is the epidermis. So you could use that same type of terminology and know that the epiglottis would be higher in the respiratory tract and the glottis would be lower. The epiglottis is in the pharynx and the glottis is actually in the larynx. Okay. And as we said, further down in your respiratory tract is your larynx then, which will house the vocal cords. And you split that into two areas. You have true vocal cords and false vocal cords. One way to think about that is very much like that of the ribs. You have true ribs and false ribs. And in this case, it's the true vocal cords that will produce sound. These false vocal cords then will not then. So again, the epiglottis will cover this and keep materials from entering the esophagus. The glottis then, so epiglottis, glottis then, will close, and it's a structure like this that opens and closes and not only produces sound, but then will also keep materials from traveling further down into your respiratory tract. And again, since the false vocal cords do not produce sound because it's just muscle and connective tissue. When you look inside the vocal cords, okay, it's an actual opening that opens and closes. Those would be the true vocal cords. And notice that's one of the aspects you don't want to try to breathe, you don't want to try to talk, you don't want to try to do anything when it is you're trying to swallow, because that's how foreign objects end up in your trachea, or further down into, I believe the first portion is your bronchus, okay? Since that has a U in it, that's further up in the respiratory tract, okay? Then you have your bronchi, and then your bronchioles. Your bronchioles have little tiny holes that would lead into your alveoli. Okay, so again, you have your bronchus, your bronchi, your bronchioles, and then finally your alveoli. And then when we're producing this sound, okay, the air is not only just coming through your true vocal cords in your larynx, but travels through your pharynx or your throat, okay? Because as we know, you may get stuffed up from any various reasons, whether it could be a virus or a bacteria causing strep throat, And if that becomes inflamed, that would change the pitch of the sound coming out of there. And your tongue works with your lips to do pronunciations, like when it comes to the letter P, for instance, unless it's silent like that, of pharynx. But when you say garden P, well then that is one of the aspects. Your tongue and your lips work together to allow you to enunciate and speak. Now, whether it's clearly or not, speaking clearly, that's a different discussion for a different time. Because one of the aspects, you can change the pitch of your sound, and your true vocal cords do that. If you're trained to do that, in other words, in chorus, you can change the pitch, and it can make it go higher or lower. When you have some of this muscle tissue that has an effect on your true vocal cords, okay, you can make it go lower or you can make it go higher, okay, and that happens within this structure. I'm trying to think of, like on the show The Voice, one of the coaches used to be Adam Levine, of course, from Maroon 5. And for some reason that comes to mind. He has a very high pitch that he can obviously perform and do to sing higher notes, or can possibly go lower than as well. Okay, but that's just one individual that comes to mind. Okay. So if you have a lot of air going through there, then you can really have your voice go up. Or if there's less air moving through, well then you're going all the way down to maybe not just a low pitch, but getting down to a whisper. It just depends upon how much air you want to be moving through there. And one of the things I try to do, and we said this before in class, is trying not to sound with the same pitch, the same tone, and the same, not enunciation, but changing that pitch, because then it doesn't sound like you're listening to the same tone all throughout the class period, and this would probably be so boring to listen to. And we're talking about the true vocal cords, the false vocal cords, and yeah, I would probably be going to sleep too. So that's why we try to alter our pitch, so then it doesn't sound so boring, and maybe it is boring to begin with, but that's not our goal. Okay, we're up to 8 minutes. We're going to try to keep these at about 15 minutes. You'll notice that we'll have May, A&P, May 2nd, A. This video would be A&P, May 2nd, B, and then possibly make another A&P, May 2nd, C, depending upon when and how much time we have throughout the course of the day. All right. So then as you are sitting there writing this down and you're not speaking or talking, well then those vocal cords are relaxed and that glottis then is is closed then. Oh, excuse me. And again, this is higher in the respiratory tract because this structure covers the esophagus. Okay? Then lower down the glottis is an opening to that of the vocal cords. And again, the analogy that we had used is with your skin, the epiglottis. Your epidermis is on top, then your living dermal layer is underneath. Okay. And throughout the course of this, you may be hitting pause rather than having to try to write this down all at the same time and getting your content from there. Let's see here. Must only be, okay, that would get us all the way up to number 21. We're not quite going to get that far. I'm trying to think of a good spot to stop. And I think it would be at the end of this slide then. Yeah, okay. Now, it is possible for your trachea to swell shut if there's a type of inflammation that can occur for various reasons. It could be from, like what we talked about earlier, lots of dust. It could be a pathogen that could do that. But anything that's going to cause irritation, what could possibly happen with that is maybe different types of gases. Hydrogen gas would probably do that. So anything that you inhale that would cause irritation could cause your trachea then, it's not that it's going to collapse, but it's just swelling from the inside and then not allowing air to flow through. Okay, so we will stop there for this portion because now we're up to about 12 minutes. And this will be, again, A&P May 2nd or May 2, letter B. We'll catch up to you next time.